Hello everyone, this is Dr. Shalini Gupta, the Dermatology Laser and Vein Center. Hope you're all doing well, and today I thought we'll talk about Botox because everybody has heard of Botox by now. It has been around for many years and we have been using it in our practice for 20 years now. It has an excellent safety profile and most of our patients have been getting Botox on a very regular basis every few months for a really long time without any problems. Some patients are scared, a little worried or scared about Botox because it is botulism toxin. So it can potentially cause botulism if you end up with millions of units of this in your systemic system. However, when we use Botox cosmetic in an aesthetic use, we're injecting really small quantities of this toxin specifically into certain muscle groups, and it helps those muscles to relax. So that's basically how Botox works. Now, over time, there have been some new brands of Botox that have come about, and really these are all neurotoxins. That's really how I should address them. We tend to just call them all Botox because that has become such a household name. But Botox is actually a brand of a neurotoxin that is created by Allergan, and it has been the longest available botulism toxin. So these are all the different types of toxins that are now FDA approved and that we offer at our practice. So this is botulism toxin A, and then there is Dysport. Dysport has the advantage of potentially lasting a little bit longer than Botox, and we have found that to be true in some cases. There's Xeomin. Xeomin is also an excellent neurotoxin, works just like Botox and Dysport. One advantage of Xeomin is if someone is allergic to albumin or egg products, Xeomin does not have that kind of preservative in its formulation and is safe for those patients. And then the newest is Jeaveau, which is also a neurotoxin. So exactly how do these neurotoxins work? And I thought I will show you a little graph, a little scientific explanation of how Botox actually works to take some of the mystery away. But basically you have a neuron here, and there is a junction between the neuron and the muscle. And in this junction, basically once that nerve is activated, it releases acetylcholine, which are these little red dots, and these little red dots then attach to receptors in the muscle and cause that muscle to react, usually by contracting or twitching. And so to break that connection from happening, the neurotoxins basically cleave these little receptors on the vesicles that are containing the acetylcholine, and in that way the vesicles cannot attach to the cell membrane and release the acetylcholine into the synaptic space. So that's basically the mystery behind how Botox works. It basically blocks the release of the acetylcholine, which then is not able to interact with the muscle and cause that muscle to contract. Now, the effect of all of these neurotoxins, fortunately or unfortunately, is not permanent, because some patients do wish that the effects would last forever. But currently, the effects last usually about 3 to 4 months, and if you're lucky, maybe sometimes a little bit longer. So that's how it works. We can use it for a lot of different indications. Of course, the most popular indication is to help relax facial muscles, of which the most commonly requested area to treat are the frown lines between the brows. We also can treat the forehead, where you can get the vertical lines going across the forehead, the crow's feet. We can also treat the jowls, one of my favorite areas to treat. We can treat the chin. And I'm going to show you some pictures of the chin, which is fascinating. We can also treat lip lines. We can help with TMJ. We can help straighten the jawline, make it a little bit less wide and more narrow in patients. We can treat neck bands and a lot of other indications that we'll talk about here in a second. This is just showing some of the facial muscles, because Botox, unlike a filler, which is injected under the skin to plump the skin, like I said, works on the muscles. So it relaxes the muscle, and when the muscle cannot contract, then those lines that the contraction causes start to slowly disappear. So Botox can work within a few days. It starts to take its effect, And within usually a week or two, you can see a really nice reduction in the wrinkles that we're trying to stop from forming. So this is just kind of shows you some of the muscles. And this is an example of what Botox can do. In an animated state, this person is frowning, and it's also causing forehead lines to form. And if we inject Botox right into this procerus, glabellar area, and the forehead muscles, it stops those muscles from moving, and you get a nice relaxed look. Now, that doesn't mean you become expressionless, because a lot of patients worry about that, like, how will I show expression? Now, your eyebrows are still able to move, and you will still be able to show a lot of animation through a lot of your other facial expressions. You just won't be creating the wrinkles. And that is also really important, because we try to keep our treatments looking very natural. We don't want it to look overdone, but enough to where it helps soften that movement enough to make those lines disappear, because that's ultimately the goal of the neurotoxin in an aesthetic use. We just want those lines to slowly go away, but the goal is not to see paralysis or to look overdone or artificial. So these are some more examples of treatment before and after. You can see a nice reduction in the glabella and the forehead wrinkles, and everything looks really nice and smooth. Also, what we've noticed with the Botox is that it improves skin quality, and I can't really explain exactly why, but we have seen also a reduction in things like acne from Botox. And we do another procedure in our office called Aqua Gold, where we actually take some Botox and some filler usually and put it into a vial, and then with tiny little needles poke it throughout the skin, so it gets into the upper layers of the skin in a more diffuse manner in a very small quantity, and it really helps the skin just to have this beautiful glow. So we have noticed that over and over again. Not only do the wrinkles go away, but the skin quality improves tremendously and is a lot smoother. So when we do this in conjunction with skin resurfacing procedures or like an IPL or BBL laser, it gives even more dramatic synergistic effects, which is really nice. This is an example of a chin, and I've actually done this with several patients where they've come in saying that, you know, I don't really have a chin. Do you think I need a chin implant? And what some patients are doing is actually contracting their mentalis muscle so strongly that the muscle, instead of being in its normal rested position, is actually moved up. And so if you relax that muscle, it'll just gently come back down, and you won't need a chin implant. It's really pretty dramatic, and that happens within days of the injection. So it just has to be recognized. Somebody has to really steady your face properly to see where the movement is occurring, how it's occurring, and then be able to properly address those specific muscle groups and relax the right muscle groups, and then get these amazing types of results. This is another example showing that downward frown that happens around the mouth. And like I said, this is one of my favorite things to treat, because a lot of times patients don't even realize this can be treated, or that they're making these expressions and that it's leading to these lines occurring around the mouth. So I think it gives a very nice, very dramatic improvement, and it's subtle. And sometimes patients can tell after they've had the procedure, like, oh, I'm not doing that with my mouth anymore. And a lot of times their friends will even notice that they just look happier and more rested. I also love treating lip lines with Botox, especially those patients who tend to pucker quite a bit, or sometimes they're doing it in their sleep even. So we can get those lines to relax just with a little bit of Botox. Also, gummy smiles can be beautifully treated with Botox, where we can relax that excessive movement that's causing that lip to come up too high and make that gummy smile go away and look more relaxed. We can also treat, actually, just going back to this, we can inject a little Botox right at the base of the nose to give a nice little lift to the nose tip. And that's like your non-surgical nose lift. We can also treat neck bands with Botox, just a little bit of Botox right into the platysma muscle, and those neck bands just relax really nicely. We can also use Botox to treat tension and migraine headaches by injecting it along the course of where the migraine begins and then following it where one believes it is migrating to. And most commonly it's the temporalis muscle along the side of the forehead, but sometimes we inject it throughout the scalp, between the glabella, because a lot of times the migraines are beginning right between the brows or around the temples. So that can be easily done. And then I love using it for TMJ or bruxism, where one is grinding their teeth, and it also causes widening of the jawline. So we can get that jawline to slim back down, help with the TMJ, and with the teeth grinding just by injecting Botox into a few specific areas. So we can also use Botox commonly for excessive sweating. And I love this indication of Botox. We can often use it throughout the scalp, for example, in women who don't want to necessarily wash their hair after going to the gym every single time. And this has become popular as a term known as Blowtox. So Blowtox is where we inject Botox throughout the scalp. It stops you from sweating for many months, and you don't have to repeatedly wash your hair after every time you sweat. Also, it is great for underarm sweating, not only in patients who truly need it for excessive sweating, because they can't wear anything without wearing a jacket over their clothing to hide all those sweat stains, but also in anyone else who just wishes to save their nice fancy clothes from sweat stains. It's just a wonderful little tool, a nice luxury to have. We can also use it to treat, for example, the palms, for patients who have too much sweating from their palms, who are afraid to shake hands with anyone. And we can also treat the feet, we can treat the groin area. So basically any part of the body where there's excessive sweating, we can use Botox for. There are a lot of other medical indications for Botox as well. These are the aesthetic indications that we primarily use it for. So I hope that was informational. I hope that took some of the mystery away from how Botox works and how all we can actually use it. It is an artistic procedure. Placement is key. I showed you that picture of the muscles, and knowing where those muscles are, observing the movements that are occurring, and then being able to place it in the right locations on the face is really important. So come and see us when you're ready, and we will get you looking good and happy.